Josh's health wasn't perfect. We knew there was something up. He'd had an issue where he was coughing quite a bit, and he was coughing up blood now and then, but not very much. It was just pinkish. So this progressed for maybe a couple months. And then finally he just, no, it is better, but I said, no, doctor time. They started treating him for pneumonia. I guess we were at Kelly's drugstore. Josh had got into a coughing fit where the blood got a little bit darker. So then I got really concerned and I tried getting him to the hospital then, and he's, no. I said, okay, well, I'll take you home. If you're not any better in the morning or during the night, I said, call me right away, I'll come and get you. 7 o'clock that morning, I got a call. He says, yeah, maybe I better go to the hospital. I'd been sleeping on the couch with my clothes on, so there was I was up and out the door. On the way to the hospital, can we swing past Timmy's? Gotta have the coffee. And so I said, no, I said, I think we better just go straight to the hospital first.
When I looked at the x-rays initially, I just saw a complete whiteout on the one side of his x-ray. How can this be a young man having an x-ray that looks like that? The things that were going through your mind, right? And I wasn't sure exactly what it was, but certainly I was concerned, and that's when I went and got Dr. Miron.
He had his CT scan. He come back up, and just in that moment, he asked if he could go to the washroom. I thought, he's situated, I can't do anything at the time. I'll go move the truck and find a spot to park it.
As I was walking back to find her, I heard something in one of the bathrooms, and I was questioning myself whether or not I should actually just go in the bathroom and see what's going on. And I decided to. I opened up the door, and that's where I found Joshua, very unwell, and there was blood everywhere. He was very sick.
I'm not quite sure how long I was gone. I know it wasn't very long. As we walked down the hall and around the corner, I could see people in there cleaning up and this and that. Trauma equipment all over the place. There was Josh on life support. Apparently it was a total respiratory failure. He had collapsed. So he was in the washroom when that happened. And as he come out, the blood was just pouring from his mouth, and he was gasping for air. And so that's when he walked into the hallway of the ER. And so there's no doctors prepared for this or anything. It just, there it is. It's right in front of everybody's face. And it's like, what do we do?
I was in the intensive care unit rounding on my patients, and I heard a page overhead asking for Dr. Harrison to go stat to the emergency room. They quickly directed me into one of the resuscitation rooms where there was probably 10 or 15 doctors and nurses in this room. When the staff heard him fall, they went in, and it was literally like a scene from a movie. There was blood everywhere. As an outsider looking in at the situation, not having been there for the 10 or 15 minutes that they had been resuscitating him already, just walking in, I could see that something bad was happening.
Anytime you hear somebody with coughing up this degree of blood, it's you go into work mode, you go into emergency mode, because you know that this is something serious.
He required lots of medication to assist with his breathing and get him sedated enough so that we could assist with his breathing, IVs, blood work. I'd never seen that before, no, especially from a 21-year-old.
This was not a typical situation, and frankly, at that time wasn't really that optimistic. If you have a pulmonary hemorrhage, which is just bleeding into the lungs, then the lungs, the alveoli, the air sacs, become filled with blood rather than air, and the small airways become blocked off, so you can't get that air in and out on your own. So you'll die rapidly if that's not resolved.
This kind of thing happens maybe once or twice a year, here in Belleville anyway, that somebody would cough up so much blood that they almost drown in their blood. It's very rare. They weren't able to maintain his oxygen saturations, and I could see them on the monitor just dropping from the 90s to the 80s to the 70s.
If you're dealing with a reduced oxygen level for a prolonged period of time, it will damage multiple systems in your body. It's hard for your heart, it's hard on all of your other vital organs, and it's especially hard on the brain.
We have patients that die often during resuscitations, but it's exceptionally difficult when it's someone who's young.
They said, you know, you better call family members in. And basically they're just preparing us to say goodbye.
Something that I won't forget. It seemed like every physician from the entire hospital would get together, come together down to Emerge and try to do everything they could to save this young man's life.
There was a huge team involved with it. Other respiratory therapists from our department that were involved. There was anesthesia, internal medicine, emergency medicine staff, nursing staff, the anesthesia assistant staff from the OR. There were a ton of people working on him.
Everybody was giving Joshua 100%, from his bedside nurse to his respiratory therapist to every doctor that was in that room.
Nurses and doctors alike will help. You'll see the doctors take on their small bit of the puzzle, somebody with the airway for Josh, the chest tubes. The nurses will be administering medications, starting the intravenous's, and the nurses outside the room will be bringing the medications and the equipment as needed. They all come together, and and it's a nice coordinated dance.
He needed an emergent bronchoscopy. He had coughed up a blood clot that was basically stuck in his breathing tube. And so as much as we could try to pump air and oxygen into his lungs, we couldn't get it in because the tube was plugged. So we pulled it out and we replaced it with a larger breathing tube.
Once he was a little more stable and we had a survivable oxygen level in the system, then I was helping Dr. Harrison with the bronchoscopy. And the bronchoscope is a device, think of it as a small camera at the end of a flexible piece of tubing, which allows you to go through the airway and down into the lungs to have a look at things down there and to help clear secretions out, and in this case help clear some of the blood out, and to also see if we could locate a specific bleeder.
I used the bronchoscope that we had just purchased to actually localize the bleeding. I saw it was coming from the right side. We quickly rolled him onto the right side to prevent the blood from spilling onto his good left lung. And then I used the bronchoscope to insert a bronchial blocker, which is a tiny little catheter with a balloon on the end of it, and I inflated that in the right lung to contain the bleeding in the right lung so that he could at least breathe with his left lung. As soon as we did that, his oxygen levels came up. We took him for an urgent CAT scan, and the CAT scan unfortunately revealed extensive lymphadenopathy and large lymph nodes in his chest and a number of nodules in his lungs that were bleeding. Based on the imaging alone, we couldn't tell if this was cancer or if this was some type of inflammation or some type of unusual infection. My hunch was that it was probably cancer. I updated his father, Glenn, several times. We were doing everything we could to save his life, but there was a real possibility that despite our best efforts, he was still going to die.
It was hard. When I contacted my brother, as I told him, I said, I'm not quite sure what's going on here, but sorry. I said, I think they're trying to prepare us for the worst. And he said, no problem. He says, I'll be right there.
It took us a good 9 hours to stabilize him. And then once we thought he was well enough to be able to survive the trip to Kingston, my colleague, Dr. Leong, had come in on a day off and he transported him to Kingston.
I'm not sure about numbers of people. I don't even know how they fit in the ambulance because for the amount of equipment they had attached to them.
I traveled in the ambulance monitoring his vital signs and administering his IV medications with Dr. Leong. When there's somebody that's sick, you're just one-on-one with the patient. So I was constantly busy, but I was only focused on him.
Well, to be honest, even until the moment he left to go to Kingston, I wasn't sure if he was going to survive. My colleague, Dr. Parker, in the ICU in Kingston received him. He's also a respirologist, intensivist. They scanned his neck and found that he had some enlarged lymph nodes in his neck, and they biopsied one of them, and it turned out to be metastatic testicular cancer. The cancer had spread to his lungs, and the spots in his lungs just spontaneously started bleeding.
Like somebody hitting you with a baseball bat. It's just like, whoa. And then I just know, I kept saying to myself, he's gonna be all right.
They confirmed the diagnosis and started him on emergent chemotherapy within 72 hours. And a few months later, his CAT scan of the chest was almost completely normal. Like you wouldn't even know that those spots were ever there. That's like a miracle. Like, people usually don't survive this kind of thing.
When the doctors tell you to make arrangements, his final arrangements for 5 days every morning, that no, he's not going to survive. And then within a week later, it's a total turnaround. According to the doctors I talked to, it'd be like winning all the lotteries on the same day.
You know, had this happened an hour or two earlier at home, he would have died. There's no way any ambulance would have gotten him to hospital in time. If this had happened at our hospital a few months prior, when we didn't have a bronchoscope, he would have died. 2 months after this event, I had the opportunity to see him again at Belleville General Hospital when he came back to our emergency room to thank all of the people that had saved his life. It was like, it was actually like a miracle to be able to see him alive and talking like a normal person.
Donors have always been the backbone of any hospital, and they contribute a lot from fundraising themselves to patient well-being volunteers that bring their dogs in for visits for patients that are lonely. It's all essential, you know, we're lucky in Belleville to have a good set of doctors and good set of nurses and excellent staff, and that work very hard to keep the community healthy and alive.
It's those people that donated money to buy the bronchoscope that allowed us to save Joshua's life. It's really a miracle that we were able to save his life here in this small community hospital with such limited resources. It was just, it's kind of proud of us.
How important are these donations, and you know, what would you say to the people that are watching this?
The main thing is thank you. If it wasn't for their help and support, Josh wouldn't be here.
I look at it as I was here for a reason. There was a reason why I wasn't let go. I don't know what that reason is, but there was definitely somebody watching over me that wasn't gonna let me go, clearly. With their funding to get that scope, that I would be dead. Like, yeah, their donations literally save people's lives. They may not see it that way, but yeah, it happens.